Like all tissues in the body, the heart muscle needs a constant supply of oxygen-rich blood to function properly. This vital blood supply is delivered by the coronary arteries, which wrap around the surface of the heart. Under certain conditions, fatty deposits can gradually build up along the inner walls of these arteries. As this buildup grows, it narrows the vessel and reduces the amount of oxygen reaching the heart muscle. This process is known as atherosclerosis. The three major risk factors for atherosclerosis are high blood pressure, high cholesterol, and smoking. Over time, these fatty plaques can become unstable and tear. When that happens, the body's emergency repair system is triggered. Blood cells called platelets rush to the damaged area and stick to the exposed plaque, forming a blood clot. If the clot becomes large enough, it can completely block blood flow to part of the heart. Within minutes, heart muscle cells downstream from the blockage begin to suffer and die. This is what we call a heart attack, or myocardial infarction. During a heart attack, the heart may continue to beat, but its rhythm often becomes abnormal. If a large enough portion of the heart is affected, the heart can stop beating altogether. This is known as cardiac arrest. Despite common misconceptions, a heart attack does not always look like someone clutching their chest and collapsing. While some people experience the classic, Hollywood, heart attack, many do not. In reality, heart attack symptoms are often subtle. They may begin as mild chest discomfort that gradually worsens over time. Pain may also be felt in one or both arms, the neck, the jaw, or the upper abdomen. Shortness of breath and unexplained sweating may accompany these symptoms. Time is critical when treating a heart attack. If detected and treated early, much of the damage can be prevented or even reversed. However, irreversible injury can begin within 30 minutes of complete blockage. And nearly half of heart attack-related deaths occur within the first 4 hours after symptoms start. Doctors can restore blood flow by performing a procedure called angioplasty, which reopens the blocked artery. To learn more about how this life-saving treatment works, please watch our next video.